like the hip and the knee, but especially the knee. Over and above that, because we are not aware as to what is the good lifestyle, what are the do's and don'ts, we'll end up damaging our knee without our knowledge. And then by the time the pain starts, the damage is sometimes quite extensive. So the whole idea is to understand that knee joint is very unique joint of the body. It is prone to load. It is devised by nature to take load. So it is meant to help us go up and down stairs, do squats, do lunges, walk for long durations, run, jump, and all these things. Therefore, we need to understand what to do, what not to do, and if you are prone for a high loading lifestyle, then what precautions we need to take. So, with this basic understanding that knee is a very complex and unique joint, let's go to the next slide. So, that's the brief anatomy of the knee. It's very confusing when you look at a picture, but let's just simplify with this model here. So just like you see in the picture, the knee has got a thigh bone, which is here, a shin bone, which is here, and the kneecap, जिसको हम वाटी भी बोलते हैं, घुटने की वाटी. So this is roughly the knee anatomy in terms of the bones. उसके बाद there are ligaments. Ligaments are these bands. So there are 4 ligaments, one on the outer part, one on the inner part, and one on the front of the knee. This is the one that gets most commonly damaged, called as the ACL. And there is one at the back of the knee. This gets damaged, especially if there is a biking injury. Bike se agar gir gaye to ye PCL damage ho jata hai. Other than that, there are 2 other important structures which help you take the load. In fact, 3 structures. One is the cover of this bone called as the cartilage. It is there on the thigh bone as well as on the shin bone. Then this rubber-like thing. There are 2 rubber-like things. This is the cushion, gadi, also called as the meniscus. This will be like a shock absorber. ये घुटने के shock को absorb करता है. So if this is damaged, then the shock comes on the cartilage and knee starts getting spoiled. So cartilage, meniscus, and the bone supporting the cartilage and the meniscus called as the subchondral bone. ये 3 चीजें हैं which help to take load in the knee. So that's the brief anatomy of the knee. Let's go for the next slide. So obviously, knee pain cannot be the same in a 12-year-old, in a 30-year-old, in a 40-year-old. So as per the age, different reasons are there for knee pain. And let's go through them as the slides progress. Next. So that's a very long list of problems. Let's not go there. Don't even try to read it. Let's just look at the model. What I can divide it as, there are issues related to the tendons. So usually, if you are an active person, if you are involved in sports, running, etc., especially when you are in the young age, then you can damage these tissues. So your tendons, they are called as tendinitis. You can have quadriceps tendinitis, you can have hamstring tendinitis, you can have bursitis. So these are all injuries because of stress. So that is one category. And more often than not, tendinitis, bursitis can be managed with good physiotherapy. We have to guide as to what physiotherapy is needed. Common mistake which patients do is they visit the physiotherapist directly. The physiotherapist may be able to understand what is the problem, but it has to be evaluated by a knee specialist. And a knee specialist, along with the physiotherapist, can make sure that these problems are completely treated. So tendinitis can be treated with physiotherapy. Next slide. Then there is something called as repetitive stress. Because of repeating the stress on your knee, you can develop some tightness of some tissues. Okay, so for example, a very common problem is the tightness of the tissue on the outer part of your knee. It's called the IT band friction syndrome. This is very, very common reason for knee pain, especially in athletes. And there's an important concept to understand, that our knee is not an isolated entity. It is closely linked to the hip joint, and it is closely linked to the ankle joint. So there is a cycle that sets up. एक बार अगर एक टिश्यू टाइट हो गया तो हिप का एक टिश्यू वीक होने लगता है. So there is a tissue in the hip, a muscle in the hip which starts getting weak. The name of the muscle is gluteus medius, for example. If that gets weak, then there's a cycle. So knee tightness leads to hip weakness, leads to more knee tightness, more knee weakness, and the pain becomes chronic. So in conclusion, whenever there is a tendinitis or a tissue tightness, a proper evaluation needs to be done as to which tissues are tight. They have to be released, evaluation needs to be done. Which tissues are weak, muscles are weak, they have to be strengthened, and that comes under what is called as rehab, systematic rehab. Next slide. When we talk about injuries, now this was about repetitive stress or about tendinitis in active people. That can be easily solved. But if a person has injuries, it's a different thing altogether. Some tissues can get damaged. If they are damaged, they can lead to some symptoms. So if a ligament is damaged, for example, we'll discuss that in detail. But if this ligament is damaged while dancing, for example, you are doing garba, you're coming down from stairs because of water, you twist your leg, then you can break this ligament. So once the ligament is broken, then you will have some symptoms. They are called as mechanical problems. So if the ligament is broken, you can have a mechanical problem of lachak. So the knee will not hold grip. You will feel as if you are falling down, or also called as instability. So they are called as mechanical problems. Sometimes you can have a tear in the cushion. So if your cushion is torn, the piece of the cushion can get stuck in the knee and the patient can have severe pain. They can also have a lot of locking. So like that, there are many symptoms called mechanical symptoms. And most importantly, you can have repeated swelling in the knee because the internal tissues are getting more and more damaged. So these all come under mechanical problems. Next slide. So this is what we were discussing, and a few other slides to explain the same thing. You can have an ACL injury. This is a common knee injury to happen. It happens in basic lifestyle, not necessary in sports. Simple things like you are in the bathroom, you're coming out, there's water, you twist, you can have a injury. You climb a stool, you lose balance, you fall down, you can have an injury and tear in the ACL. Of course, you can have it in sports like football, especially cricket. You can have it while dancing, like I said. You can fall from the bike. You can have multi-ligament injury, so ACL along with MCL along with PCL. So injury-prone ligaments are the ACL, and definitely if there is a unfortunate event like a twist where your foot is on the ground and the entire body weight comes in an abnormal angle, you can break your ligament. You can also break your ligament. You can also break your meniscus, and these are called as tears, different tears in the knee. Next one. So here we see that same explanation more in detail, that if there is a damage to the ligament, to the meniscus, and sometimes to the cartilage, you can have a damage to the cartilage, and a piece of the cartilage can come out and get locked in the knee. So as you can see in the slide here, there is a piece lying down there. If there is any piece lying down there, it can cause locking in the knee, and that is also something which is very disturbing to the patient. We talked about IT band, so you can see a slide on IT band. So there will be a lot of pain on the outer part of the knee, and a simple rehab program focused on the stretching of the IT band. It is done with dry needling, it is done with foam rolling, it is done with stretching exercise program. All these things will help. Now on the lower left hand side, you can see a very nice picture. Actually, it's very nice that this picture is here, and this explains that knee is not in isolation. The foot of some people is like a flat foot. They will also have what is called as the shin bone is rotated internally. Okay, and because of this, they have constant overload of their kneecap cartilage, which can cause pain, and they are constantly prone for IT band tightness. So if you identify this, if you give a good insole on the foot, if you stretch the IT band, if you strengthen the weak muscles, if you strengthen the gluteal muscles and what is called as the core muscles, then these patients who are born with these abnormal angles can be relieved of pain. So more often than not, what happens is patients come with pain, nobody exposes the whole leg and identifies these things. Painkillers are given, and the patients are frustrated as to why my pain is not coming down in spite of meeting multiple doctors. So this is a very good slide which talks about what is called as the kinetic chain, or what is called as the alignment. And we need to take home messages. Look at the foot, look at the shin bone, look at the kneecap, look at the thigh, if there's any abnormality in the angle, and accordingly supports like braces, insoles, arches, and good rehab needs to be done. Thank you. Next slide. So this is a slide which talks now about what is commonly affecting people in the fifth decade, 50s, 60s, and 70s. So as you can see, there's a healthy joint where the cartilage is normal, and there is a cartilage which has become damaged. So healthy joint is having a smooth cartilage. When it gets damaged, it becomes rough, and that is called as arthritis. Arthritis mainly which we have in our population is osteoarthritis, which you can see in the middle slide there. So osteoarthritis is because of repeated wear and tear of the cartilage, and this is a very common problem. It can have a genetic predisposition. There are other reasons like body weight, etc., which the next slides will show. But osteoarthritis is the most common form where there is wear and tear because of genetics, body weight, etc. The other option is what is called as rheumatoid arthritis. This comes under a category called inflammatory arthritis. So inflammatory arthritis means there is something in the blood of the patient which is going and creating swelling inside the knee. The swelling is reducing the blood circulation to the cartilage, and then the cartilage is getting affected. So inflammatory arthritis, commonly which we see is rheumatoid arthritis, but there are various forms of inflammatory arthritis. There can be crystal deposition because of uric acid, and few other rare conditions are there which cause inflammatory arthritis. This is also commonly called as Sandivat, where multiple joint pains happen. It is not only one joint usually. Osteoarthritis can affect only the knee joint. It can affect hip and shoulders and spine also, but osteoarthritis commonly affects the knee joint. If a patient has inflammatory arthritis, usually they'll have other joint pains also. Next slide. So that's another image of this kneecap pain. So if the kneecap is abnormally loaded, the cartilage can develop damage and it can have pain. So we discussed a few points. We discussed about tendinitis in active people of this tendon, of this tendon. We talked about overload because of repetitive stress. If somebody is into heavy impact activity, they can have. We talked about somebody has got abnormal angle, they can also develop this load. So various reasons can have a abnormal load on the kneecap. And that requires a proper evaluation by an expert knee specialist to find out why the pain is there, from where it is coming, and the physiotherapist has to be guided properly. So it's a team approach to relieve of the kneecap pain, also called as the patellofemoral pain. Next slide. So this is simply speaking as to what are the risk factors for a person to develop knee arthritis. Okay. So knee arthritis, like we discussed, the cartilage which is soft becomes rough. So first thing is age. Asians are prone for knee arthritis above 50. So we can't help it if there is a genetic cycle. It is more common in ladies. It is definitely related to body weight. So all of us should understand that overweight and high obesity is something which is prone for this injury, for this damage. So we see during arthroscopic surgery, even in 30s and 40s, if a person is overweight, already cartilage has started damage. So if you are doing the surgery for ACL or the meniscus, we see that the cartilage is already damaged. The person is not feeling the pain of the cartilage, but definitely overweight is a risk factor. Obviously, joint injury. If somebody has had multiple injuries on the cartilage because of jumping and heavy impact, then that small injury can also lead to more arthritis. If a person is involved in bad lifestyle, so if they are involved in heavy impact on the knee, then also this can cause repetitive strain. And some people's joint structure, and we'll discuss about that, some people's knees are not exactly like this. It is either bent in one direction or the other direction. So this abnormal bend also can cause this joint structure, or abnormality of the bend can also cause arthritis earlier in life. Next. So we discussed about the ligaments. So we discussed about the ligaments and the injuries. Usually, most common injury is the ACL, anterior cruciate ligament. If it's a complete rupture, then the person will have instability. And it is one of the most successful surgeries in orthopedics where we reconstruct the ACL. If there is a meniscus tear, we repair it and through small keyholes, no cuts in the knee. It's one of the best surgeries of the recent few decades, wherein a person who is active can get back to full activity after a ACL arthroscopic surgery. Similarly, the PCL, the MCL, that is the medial collateral and the lateral collateral like ligaments, whenever damaged, can be appropriately repaired. Next. So this is how we discussed that the common knee injuries for ligaments happen. As you can see, that dashboard injury on the left hand side. So that's typically in Bombay, for example, if you're traveling in an auto rickshaw, there's a sudden brake that has been put, your shin bone can hit on the front and you can have a PCL injury. So that's called a dashboard injury because the shin bone is suddenly pushed at the back and the PCL ligament is torn. The other injury that can happen is while football, suddenly the leg can get abnormally twisted and you can break your ACL. And While walking, if your foot gets stuck in a khadda and you have a twist, again you can break the ACL. So these are the various common ways you can have injuries. So what you have to be careful whenever you are walking, you need to make sure that the surface, if it's uneven, you need to be very careful. You need to have a good core strength. You need to have good balance so that even if there's a minor twist, your body can control it. And of course, in sports for the youngsters, you need to be careful that there is no direct impact on your knee. Next slide. So, what are the symptoms of if there is a ligament injury? How do you get to know? So, typically, what will happen is that the person will feel a snap in the knee. He'll feel something wrong, and they will suddenly fall down. They will find it difficult to stand up initially. Some of them can stand up and then, with pain, walk to their house. Some of them might feel pain for a while. They continue playing, and the knee buckles again. So, never do that. If there is an injury, you have felt a snap, you felt a swelling, immediately do icing, go back, take rest, and if the knee pain persists, then it needs a further evaluation by a specialist and an MRI usually. So injuries like ACL, like meniscus, will cause pain, swelling, difficulty to walk. That's the main thing. Next slide. Coming to the meniscus injury, we talked about the ACL. So the meniscus is this cushion here. If there's a meniscus injury, then there will be a presence of swelling in the knee, and the person will have difficulty to walk. And that pain will not come down with painkillers; it will persist. And there can be various types of meniscus tears, especially if it's what is called as a bucket handle tear. So just like a baldika handle, the meniscus can get torn and can get detached and get stuck up in the knee. So such patients will have locking. Meniscus tears can also happen in patients who are in their 40s without injury just because of stress. So, persons who have a genetic predisposition or a bend in the knee, they don't know it and they get into heavy squats, lunges. They climb the stairs of the office just as an exercise. They don't know that they have a natural bend and they develop overload tears of the meniscus. They come under the degenerative category. Meniscus tears which happen in an arthritic knee, especially a patient who is in the 50s or 60s, if there is arthritis, then such meniscus tears don't require any surgical intervention usually. Next slide. How do you know if you have got a meniscus tear? You'll, as I mentioned, you'll have locking, you'll have catching, you'll have repeated swelling in the knee. When you press your knee in one of the areas, you can have severe pain. So pain, locking, catching, and swelling. These are the various sensations that you can have if you have a meniscus tear. Next slide. So this is how a keyhole surgery or arthroscopy in which I specialize is typically done. A very small hole is created in the front of the knee. A special instrument called shaver is used and the original ligament is taken out which was broken. Sockets are made in the knee with a very fine instrument like so. These are small 6 millimeter, 7 millimeter sockets that are made. A new ligament is created from a graft from your body and that ligament is held with the help of buttons and the new ligament is nicely tensioned. And this ligament gives the strength back along with physiotherapy. And a patient who's undergone an ACL reconstruction through arthroscopy can get back to full activity, whether it is dancing, whether it is running, sports. So we treat a lot of high level athletes, sportsmen, dancers, etc. They get back to full action. Next slide. So let's talk about osteoarthritis more in detail. As we discussed, where the cartilage is completely worn out is what we call as osteoarthritis. Next slide. So that's the normal knee joint. So people talk about gap. Okay. So what is gap? As you can see on the right hand side, the normal space between the thigh bone and the shin bone, because the cartilage is completely damaged, that space starts getting reduced. So that is called reduction in the gap. And that is a classic sign of, yes, so that is a reduction in the gap. That's a classic sign of arthritis of the knee. Next slide. So we are going now going to discuss about a reason for arthritis in the knee in a young population. Typically, we see this in the 30s and the 40s. A person can have arthritis in one half of the knee, especially the inner half. This is the inner half because of the bend in the knee. So the knee is not straight; it is bent in one on one side. So let's take the video to the front position, forwarded position. Let's have the volume.
should be vertically aligned, like stacked block compared to the narrow space in an osteoarthritic knee. When you stand or walk, the hip, knee, and ankle joints ideally should be vertically aligned, like stacked blocks. In an OA knee, the narrow space and pain associated with the disease can often lead to an abnormal gait, which can throw off this natural alignment. The resulting misalignment is often associated with OA, although both the lateral, outside, or medial, inside of the knee can be affected. The majority of people with OA have medial OA. You may compensate for this painful knee by limping to reduce the weight on that side of the body. Over time, knee OA can also lead to pain, instability, and stiffness problems with your knees, hips, and
So what is basically simply being told here is that some people will have a malalignment. So the leg is not really straight. It is malaligned. So this is what is typically common in our country called as the bow knee. So the legs are like bow. Now the bow, whenever it is more on one side, that part will undergo arthritis. The outer part will be okay. The person will have severe pain, difficulty in walking, going up and down stairs. And you can correct the alignment. You can straighten this alignment. It requires a surgical procedure called osteotomy. You can straighten this alignment, and once you've straightened the alignment, then automatically the worn out portion gets offloaded, and the patient can have an absolutely normal life, even if they have arthritis in one half. So osteotomy surgery is done for patients with malalignment. Some people will have what is called as knock knees. So their legs are bent in this direction. So they will have wear and tear in this component. They will also benefit from an osteotomy. So we need to remember that arthritis in young population can be related to malalignment, and these patients will benefit from an osteotomy surgery. Next slide. So this is a arthroscopy image of the normal cartilage. The left hand side is the normal cartilage. It is smooth, it is strong, and it has got no rough spots. As you can see in the middle slide, there is moderate amount of arthritis. So usually in moderate arthritis, what happens is the cartilage becomes like a crab meat. It becomes very friable. And in the severe arthritis, you can see that the complete cartilage loss is there and the bone underneath the cartilage is exposed. This severe arthritis usually requires a knee replacement. So the whole idea is how to prevent from the arthritis from become from normal to worsening to moderate and severe arthritis. That's the whole discussion in the next slides. Next. So that similarly, you will grade the arthritis. So you saw the normal cartilage. In grade 1, it will be cartilage will be just a bit soft. In grade 2, it will get spoiled. In grade 3, it gets spoiled both in the thigh bone and the shin bone. And in grade 4, as we saw, the bone underneath the cartilage will be exposed. So usually grade 3 and grade 4 arthritis will require surgical intervention. Grade 1 and grade 2 arthritis can be managed conservatively, and there are a few modalities we rely on to prevent the knee from going to grade 3 and grade 4 arthritis. Next slide. So we discussed about different grades. You can go through the animation.
Osteoarthritis is among the most common joint disorders and is characterized by joint pain due to wear and tear of the joint. This animation demonstrates the progression of the condition through 4 stages. Here's a healthy knee with healthy cartilage allowing for smooth motion. Grade 1 is partial damage of joint cartilage, characterized by minor bone spurs or osteophytes, as well as very minimal joint space narrowing. Grade 2 has moderate cartilage damage with definite osteophytes or bone spurs and apparent joint space narrowing. Grade 3 has multiple osteophytes or bone spurs with definite joint space narrowing, with apparent sclerosis of the bone. Grade 4 is the most severe. It's bone on bone with multiple large osteophytes or bone spurs with marked joint space narrowing and severe sclerosis.
So summary, there are 4 grades of arthritis. It is grade 1 and grade 2. It's the early stage. Cartilage is still holding on and it can be managed without surgery. Grade 3, especially grade 4, will require a surgical intervention. Next slide. That's how x-rays have to be taken. The only take-home message in this slide is it's a very common mistake to not do x-rays on standing position. They are called weight-bearing x-rays. A knee joint is, as we discussed in the first slide, a load-bearing or a weight-bearing joint. So the x-ray has to be taken in the weight-bearing or the standing position. Otherwise, you will never get the true amount of damage in the knee. Next slide. Next slide. So you should never ignore osteoarthritis. There are few patients who can have osteoarthritis affecting multiple joints, including the hand joints, spine, hip, knees, of course, and the shoulders. So whenever you have multiple joint pains, it should never be ignored. We need to find out if you have a predisposition for osteoarthritis or any of the inflammatory arthritis. A good knee specialist will be able to guide you. If there is an inflammatory arthritis, then some blood modification drugs have to be taken. These are called as disease modifying drugs. They have to be taken to relieve you of the pain. For osteoarthritis, we will discuss what can be done in the next slides. Next. So what are the risk factors? So this is a very good slide uh, which summarizes the whole discussion today. Anybody who has a genetic predisposition and are now entering in their 50s or 60s can have arthritis. Something which is in our control is to prevent excessive body mass index. So body mass index from 25 to 30 is considered to be overweight. Most of us are overweight, but the minute you are entered more than 30, it's class 1 obesity, 30 to 35. 35 to 40 is class 2, and above 40 is class 3. So as you enter into obesity category, you will develop knee cartilage damage, and sooner than later, knee arthritis will develop. Now, if you're genetically having a bent knee, you need to be careful. Do not get into loading activities like squats, lunges, going up and down stairs. And if you have developed the arthritis, alignment, if it is completely bad and arthritis is developed, still there's no need to be worried. You can become completely fit by thinking about an alignment surgery, especially if you're in your 40s and the early 50s. Uh, some young girls can have a knock knee or because of vitamin deficiency in the young age. And if there is a knock knee, they develop some cartilage damage. These young girls can be again treated with osteotomy. They can go on to have a very, very healthy life. And finally, if you are into high impact activity like CrossFit, like jumping from heights, etc., then you need to be careful. You need to have a very good trainer, a good rehab specialist, a good knee specialist to guide you as to how you need to keep your hip muscles, core muscles, knee muscles strong so that the impact reduces on your cartilage. And as a habit, it is in our population very common to sit cross-legged on the floor, Vajrasana and Yogasana positions. So what is recommended is that if you have a fit BMI, then it is really okay. But if you are on the higher side of BMI, it is better to avoid these activities like sitting cross-legged, kneeling down initially as your weight comes down, and reduce the number of times of yogasana, etc., in that odd position that you do if you're on the overweight side. Once your weight is on the optimum side, if there's no cartilage damage, there's no harm. Next slide. So the entire point is let's not allow our knees to get into the grade 3, grade 4 arthritis unless you're genetically predisposed to such issues. If it's not that case, then it is in our hands to control our body weight, control our lifestyle, and meet the appropriate specialist to prevent this from going into advanced arthritis. Next slide. So this is a busy slide. There are a lot of points here. Little bit points are related to hip arthritis also. Some patients can have, just like how we talked about abnormal angle in the knee, there can be a similar abnormal angle in the hip, which if it is there, the person can have hip pain and early arthritis in the hip. That again can be treated with appropriate exercises. And if the abnormality of the bend is more, then arthroscopic surgery can be done in the hip joint. We do that routinely for those patients, and they are completely relieved of the pain. What is in our hands is to prevent overweight, getting into overweight and the obesity category. What very important is as your age advances, especially in women after menopause, after the benefit of the hormonal protection goes away, then the bones start getting weaker. So as I discussed the third component, we discussed about cartilage, we discussed about meniscus, we should also understand about the bone supporting this. This is a subchondral bone. If the person develops osteoporosis because of age, because of after menopause or hormonal changes, then the subchondral bone can get weak, and that can also initiate arthritis. So we can definitely take care of this after menopause. You can get yourself scanned to make sure that you do not have osteoporosis, and that can be treated extremely well. And of course, as you get older, the muscles become weak. We need to make sure that you undergo good physiotherapy, you undergo good diet, vitamin D3, etc., so that your muscles don't go weaker. Next slide. So again, summary of the what we've been discussing: how to prevent lifestyle modification, good rehabilitation, so that the muscles are strong. Next slide. So the American Academy of Orthopedic Surgeons guidelines are very similar to what we discussed. It's better to, if you have developed knee pain, it is better to do aerobic exercises, aquatic exercises, so swimming, and especially cycling. If you are having knee pain and you want to remain active, cycling, either a stationary cycle in the gym or a regular cycle, will work wonders. Contact a good dietitian for the weight loss program, a good physiotherapist for the strengthening. So it's a team approach. A good knee specialist, physiotherapist, dietitian, fitness trainer, all of them have to be weight reduction. That is something we see very commonly. Person who's a heavyweight starts doing squats and lunges by the trainer, and then they develop some meniscus tears, and then their whole journey gets affected. Next slide. So what are the non-surgical treatments for osteoarthritis? Next slide. So you can have some injections. So gel injections, some of you might have heard about this. So those can be given in young arthritic knees. PRP is also called as platelet-rich plasma. So next slide. Some blood is taken from the knee. It is centrifuged in a machine, and platelet-rich blood is injected back in the knee. This can help in pain control for the early arthritic knees, especially in young and middle age. And if you have, next slide, and if you have a bend in the knee, there are special braces called offloading braces. So these are the braces which can be a game changer, because if there's a mild bend and the cartilage is early damaged, you can just use this brace, it offloads. So you can see in the slide, there is a dial there on the outer part. So that dial will give a push or a thrust onto the knee and offload the worn out area. So it becomes a game changer for patients who have a bend and who have severe pain. They can actually manage an active lifestyle. They can even walk, jog, and play a sport wearing that brace. So we will select those patients carefully and then guide. So anybody with a malalignment can use the offloading brace. Next slide. We discussed about this. Blood is taken from the patient himself or herself, centrifuged, and platelet-rich plasma is then injected back. This has got some pain-reducing, pain-relieving help. The ability for it to regenerate cartilage has not been documented yet, but it is used for pain relief. Next. So we discussed about this. Next. So between HA and PRP, the main difference is hyaluronic acid is the gel. So arthritis reduces the gel of the knee. So the hyaluronic acid replacement can help you. Both of this can help a grade 1, grade 2 arthritis patients to manage for a few years before their knee becomes completely damaged. So they are one more additional treatment option along with everything that we have discussed to help you tide over pain. Next. So in summary, knee pain, we have tried to discuss in the last half an hour what are the various reasons. More often than not, we can prevent them if you are guided properly with the help of physiotherapy, lifestyle modification, medicines, braces, weight reduction program, and with injections whenever indicated. Thank you.
So thank you very much for your wonderful presentation. You have explained each and every aspect of the knee pain causes and what are the various non-surgical treatment options also. I really appreciate, Doctor, very patiently you are explained in more than almost 40 minutes now. So with your kind permission, when you are talking about the non-surgical treatment option, you are highlighted on how the offloading braces plays a major role when it comes to the non-conservative treatment option. My colleague is going to have a small presentation with your kind permission. Rogan, are you ready now? Hello. Rogan?
Yes, sir. Yes, sir.
Yeah. Please share quickly. Participant, please be ready with your question. Okay. After this is a small presentation we are going to do. After this presentation, please raise your hands. Okay, so that I will allow one by one to talk to the doctor. Or if you have any questions also, please leave it in the chat box. I'll convey to the doctor and I will give the answers to your questions.
Thank you, sir.
Thank you, Rogan. You go ahead now.
Thank you, sir. Thank you for giving me this opportunity. So today I'm going to talk on how an offloading brace is going to help us, managing the knee pain conservatively. So first of all, let's understand what is offloading brace. As mentioned by uh, sir during the presentation, that offloading brace is nothing but a knee brace which help us to offload the knee with help of three-point pressure mechanism. So there are different braces available in the market. So today we are going to discuss about offloading knee brace for osteoarthritis. It's called OA, osteoarthritis knee brace. In general, it is called offloading knee brace. So there are several braces available in the market. So today we are going to compare, uh, you know, do a comparison between an offloading brace and a compression sleeve. So you might have seen compression sleeves in the market many a times. So compression sleeve is nothing but a knee brace which is made up of elastic material, so which will help us to get rid of swelling or pain with the help of compression. It will give the compression to muscles which are nearby the knee. It will not help us to address the exact issue, which is rubbing of bones or the pain because of degeneration of cartilage. So today we are going to understand how offloading brace is different from a compression sleeve. So as mentioned by doctor, offloading knee brace has a, if you can see this, there is thumb wheel dial in offloading knee brace, and you are seeing two straps over here. So these two straps will apply pressure, and the thumb wheel dial will apply pressure on the opposite side. It's a three-point pressure mechanism. With that, it will offload the knee. So if the deformity is there, we have to apply a brace accordingly, that the thumb wheel dial has to be on the opposite side. So it will push the knee, and this thing, two straps will uh, apply pressure in the same direction, and the thumb wheel dial applies pressure in the opposite direction. So eventually it will open the joint space, or it will increase the joint space. So what happens if there is increase in the joint space? So the whole, this thing, osteoarthritis concept is, the degeneration of cartilage. So when the cartilage degenerates, uh, there will be rubbing of bones, or because of degeneration. So osteoarthritis is a progressive disorder. It cannot be reversed. So that we cannot do anything for osteoarthritis, but we can avoid the rubbing of bones. There, freestyle way will help with the help of offloading mechanism. So offloading is nothing but transferring the load from affected side to the unaffected side. So now, as we have discussed about compression sleeves. So as I said, offloading knee braces are available in market. So in that, freestyle OA is a unique offloading knee brace which provides a thumb wheel dial. It doesn't require a key or any additional support to apply the brace. It is very easy to apply, and as you can see over here, before and after. Before applying the X-ray, there is no joint space available over here, and once you apply the knee brace, you can see a visible joint space. So by increase in the joint space, there won't be any rubbing of bones. So this is the difference. There is no joint space. By applying a proper pressure with freestyle way, you can see the joint space. So this is the mechanism. So we are applying the pressure, it is increasing the joint space. So features and benefits are very, very straightforward. Freestyle OA is a combination of compression sleeves and offloading brace. So it will give the results of the benefits of compression sleeve, as well as it will offload the knee. So it's a complete solution for the knee osteoarthritis pain. And you can adjust by on your own. You don't require a Allen key or any additional this thing material to adjust the knee. So these are real X-rays of patients who used offloading brace, freestyle OA knee brace. So here, this is before X-ray, and these are all after X-rays. So as you can see over here, there is no joint space available, and you can see there is a increase in the joint space. So there are over 6,000 patients, happy patients are there in India right now. And if you want to try this brace, currently we are providing a free home trial, free home demo of this brace. As mentioned, as Doctor rightly mentioned, not all knee pain patients are fit for offloading brace. No, not all patients can use offloading braces. So only doctor can suggest who is the right patient for the brace. So I would suggest you to go and discuss with doctor regarding the brace. And if you are a right person to use the offloading brace, kindly fill out the form. We'll share in the WhatsApp group, and we'll come and give a home demo for 24 hours to you. So there are different body types currently, right? People who are with a higher body mass index, for them we have a different knee brace. It is a compact X2K knee brace. So there are two hinges available, and it's a unique offloading knee brace which can give pressure, superior pressure than this thing, freestyle away. So this is a real testimonial of a patient. Before using the brace, she was struggling to walk, or she was struggling to climb the stairs, as you can see over here. But once the brace is applied, she can effortlessly climb the stairs. So this is a real, example or testimony of a patient getting benefited by offloading knee brace, compact X2K knee brace. So on the flat surface, you can see that difference very clearly. So this is the difference. She can walk on a flat surface without any support. You can see her shoulders, very confidently she is walking. So this is what offloading knee brace will give you. It will give the support whenever you require, and it. So thank you very much. Thank you very much, doctor, for giving me this opportunity. And whoever wants to try the brace, we'll share the link and kindly reach out to us. Thanks a lot.
Thank you very much, Rogan, for your wonderful presentation on the offloading braces. Maybe our participant, they understood what is the difference between the normal knee sleeves which are available in the market and the offloading brace. And doctor also highlighted and what is the role of offloading braces in the conservative treatment. Thank you, Rogan, once again. Doctor, now we'll go to the question and answer session. A few of them raise their hands to talk to you. A small request to the participant: if you want to talk to the doctor, please raise your hand. I will allow one by one. Mr. Amarjit Arora, please unmute and talk now.
Thank you, sir. Thank you.
Sir, please unmute. I think, sir, your mic is not muted already. Please. Sir, I think he is struggling to unmute. I will allow another one. Sunita Jagannath, please, you go ahead. Hello. Next one, Mr. Krishnan Subram.
Hello, sir.
Yeah, hello, Mr. Krishnan. Good evening.
Namaste. I'm from Bangalore. My wife has a knee problem, and when we had a digital X-ray, it said it was grade 2, and she has been put on painkillers. There seems to be no relief in that. So I would like to advise, and would you tell any doctors whom I can consult Bangalore so that I can also go for the offloading braces? So
yes, definitely. I think on the WhatsApp group we will put up the details for doctors and the braces if need be. What you can do is at least an X-ray, and Ramesh, you can share my details with Mr. Krishnan.
Yes, sir.
At least her X-ray and her standing photograph.
yeah,
You send it to me. There are some special X-rays which we do for patients with grade 2 arthritis called a scanogram. It's a hip, knee, ankle, full length X-ray. A simple scanogram also can give immense information. If I may ask, how old is she?
she is 65 years old.
Okay. So a scanogram, whatever X-ray has been done, weight bearing, and a picture of her where she's standing and her knee is exposed can give immense information as to if any offloading brace, etc., can help her.
Okay, sir. Okay.
You can get
Thank
in touch with me itself, and then I can guide you in Bangalore
Yeah.
how to go about it.
Thank you, sir. Thank you, sir. So I'll get the details. So nice of you, sir.
Namaskara.
Thank you, sir. Thank you, Mr. Ganesh. Usha Rani Sagar, please. If you want, just quickly, you can ask. Unmute and talk immediately.
Yeah. Good evening, sir.
Good evening, madam.
I'm Usharani Savan, age 67 years. I have a knee pain sometime, not regularly, but recently it was like when I get up from sitting position to standing position for 20-25 seconds, it pains, to get in straight. And then I walk, no problem. But I contacted doctor and they asked me to get the X-ray, AP standing and lateral position. And in the X-ray, they said that it's a joint space narrowing seen in medial compartment and osteophytic lipping seen at superior and inferior margins of patella. That is what they. And he said, doctor asked me not to, staircase chadna nahi, utarna nahi. Don't sit on the floor. I'm a regularly yoga practitioner, but he said that you can sit on floor and do and then get up, but don't do up and down again and again. No squatting, no lunges, nothing. And I'm a regular marathon walker, runner, but not complete running, mostly walking. So what is like he said, you can continue for 4-5 years. But since last 2-3 days, I ran for Vasai Virar marathon, and now it is paining. Paining means, it is paining, but I can walk. No, he said you can walk, you can run, but don't, सीढ़ी से चढ़ना उतरना नहीं बिल्कुल. So how do I get like? He said ki it is narrowing, but not much, but it is narrowing. Yes.
So somebody like you who is very active, which is very nice to hear, and it's very encouraging that you run a marathon, etc. It's very good. Keep it up. Now, the only thing which I can guide you is that somebody like you will require a brace because the knee is reducing its gap on one side and you want to remain active. So some sort of external support will be needed for you. Now, to know which sort of brace is suitable for you, we need to know the cartilage status on the other portion. An X-ray is told that one portion is damaged, grade 2 or whatever. But we need an MRI which can tell us what is the status of the other portion. If the other portion is normal, then there is no harm in using an offloading brace where the load is shifted onto the other side. If the other side is also damaged beyond a point, then there are some other external supports. In the external supports also, you saw a photograph where they showed a compression type, like a socks. Usually that is what is prescribed. That is not usually good. Because what happens is that the muscle, the second important thing which we talk about in the knee strength is the muscle called as the quadriceps. Now, if you wear a socks type of brace, your quadriceps becomes compressed and it becomes weaker over a time. So there are some special braces which are wraparound braces which will allow the quadriceps to breathe but protect your cartilage and allow you to remain active. So off-roading braces, special braces, and of course, like we discussed in the whole presentation, lifestyle modification, exercises, and as I told you, strengthening of your gluteal muscles and your core. Okay, so your buttock muscles and your core, if it is strong, and if you are taught how to stand up from sitting position, like you mentioned, you're having pain. So there is a particular way to stand up by activating your buttocks and your core muscles. If you learn that, then all this can protect your knee.
Yeah, I learned over last 1 week. It has reduced, like how to get up or how to even sit.
Correct.
Up to what? Yeah, that I learned. But my only question is that he said that cartilage has reduced. So is there any medicine to regenerate or something cartilage?
So cartilage, if not regenerate, at least some maintenance therapy can be taken. There are various medicines which are available. They come under the category of cartilage restoration. So chondroitin sulfate, glycosaminoglycans, these are the two molecules along with collagen. These are the 2 or 3 molecules which help to protect the cartilage. So there are various products in the market. We need to make sure that, of course, on the webinar, only a limited amount of help can be told to you.
Exactly.
To answer your question, there are chondroitin and glycosaminoglycan collagen molecules which can be safely taken to help you.
Currently, I am on the medicine, Lubrijoint 500.
Yeah, you should continue that. That is falling in the same category. So you should continue that.
So can I still continue walking? I mean, marathon I will not run now, but can I still continue walking?
So broadly speaking, we encourage walking. Broadly speaking, but then again, when we actually check the patient myself, I'll be able to guide you even more. But
Okay.
yes, broadly speaking, it's a good idea. Walking, stationary cycling is another good thing which you should do. If you know swimming, that's also excellent exercise for knee arthritis.
And can I do trekking or?
Ma'am, thank you. Actually, no. Sorry to interrupt. Actually, there are a few other patients who are waiting for their
Okay.
question to be
No,
answered.
because tomorrow I'm going for Tulsi Lake Trail. So should I go or not? Because after
Why should
listening to.
I spoil your mood and your weekend? You should go. I will tell. Without looking at you, though, definitely I'll tell you go
Okay.
enjoy yourself. But
Okay.
to answer your question, trekking
Yes.
and all these things create a lot of load on your kneecap. So when you
Mm.
bend your knee and climb, your kneecap gets overloaded. And
Yeah,
as you
yeah,
know, in
yeah.
a trekking, you have to bend. So there's a lot of load on your kneecap. That's why we say don't climb stairs because the kneecap gets
Okay.
not loaded.
Okay.
That's
Okay.
the summary. Yeah.
Thank you, madam.
Okay.
Thank you.
Okay. Thank you so much, doctor. Yeah. Thank
Thank
you.
you.
I really appreciate your enthusiasm. Thank you.
Yes.
Mr. Krishnan, you can go get quickly. You'll ask the question now because already patients are waiting for him.
I've already asked, sir. I've
Yeah.
already talked to
Okay.
the doctor.
Then Devika ma'am, please unmute and talk quickly.
Like this? Okay, okay. You can hear, please.
Yes, madam.
Yeah.
Yes. Tell me.
Good evening, sir. Thank you for everything. Your advice very nice. I'm from Bombay and I'm 70 years. And my X-ray report I got yesterday. That first I'll tell you Namaskara. I'm from Mangalore,
Namaskaram.
Kulavur.
Namaskaram.
Yeah, Namaskara. I'm from Mangalore, Kulavur, Mrs. Kulavur. Then I'm 70 years old, and I got a report that osteoporosis are seen arising from tibial and femoral condyles and patella. Then second point was the reduced joint space is seen, and third one is rest of the left knee under the review show normal radiolucency, no evidence of any fracture or dislocation is seen, no evidence of abnormal soft tissue swelling or calcification seen. Thank you. That much was report I got yesterday.
Right. So this is basically telling us that you have arthritis in the knee, osteoarthritis in the knee. Okay.
Yes, sir. Yes, sir, doctor.
So again, like you saw in one of the slides, there is a grading called KL grading, Kellgren Lawrence grading. If you send us the X-ray, we can guide you if it is grade 1, grade 2. If
Yes.
it's grade 3 and grade 4 especially, then it's an advanced stage. But before that, whatever we are discussing, we can help you with that.
Okay, very kind of you. Can I send in which number X-ray?
On the group, we'll put it up. So
Yeah.
then you can
So
send it,
I
and
will
whatever
send it.
possible on the phone, whatever possible, we'll guide you.
Yeah. Any what I got swelling about the knee. Left leg only, one leg only is paining, and the little swelling is there. For swelling, what can I do?
Icing has to be done. Icing has
I
to be done.
ice cream.
Don't put hot pack. So that's a good point. Don't put hot pack for any sort of knee trouble. Never put hot on the knee.
Hot.
It has to be ice always.
Ice cream. And I did physiotherapy also did, but there was nothing happened. Physiotherapy done, but ಎಂತ ಆಗ್ಲಿಲ್ಲ ಎಂತ ಮಾಡಬೇಕು ನೀವು ಅಡ್ವೈಸ್ ಅದೇ ಥಂಡ ಕೋಲ್ಡ್ ಬರಫ್ನ ಅದು ಐಸ್ ಎಲ್ಲ ಹಾಕ್ಬೇಕಾ ಅದು ಸಾಕು ಓಕೆ ಥ್ಯಾಂಕ್ ಯು ನಮಸ್ಕಾರ ಒನ್ಸ್ ಅಗೇನ್ ಅಂಡ್
Namaskaram.
ವೆರಿ ಕೈಂಡ್ ಆಫ್ ಯು
My pleasure.
Thank you, madam.
Ramesh, there was one question in the chat of
Yes, sir.
Mrs. Ankita Khare. She's asked, she's been advised about arthroscopic surgery for meniscus tear.
Yes, sir.
She would like to know how much time it takes to get back to normal lifestyle. Now, arthroscopic surgery for meniscus tear is something which we advise with a lot of precaution because we try to repair the meniscus. Only if we are sure that that tear is severe enough that it requires surgery and it can heal with repair, then we usually advise meniscus surgery. If it's a meniscectomy, that is when you remove meniscus tissue, then we have to be very sure that it is a very small portion that we are removing. Otherwise, the pain can actually worsen. So again, information on this webinar, only that much I can say, ki as far as possible, if it's a meniscus surgery, it should be repaired, and there should be good amount of confidence that that repair will work. We can
Thank you
take,
very much, doctor.
yeah.
One more question. There is one question. I have a grade 4 arthritis. Can you let me know a treatment or a phase of solution without surgery? Is a grade 4.
So grade 4 osteoarthritis means bone on bone. That means bone is touching onto bone. Bone is touching onto bone. There is nothing in between. No cartilage, no meniscus. So every time you stand, bone is rubbing on bone. And that is creating a lot of pain inside. So we can postpone the knee replacement for grade 4 osteoarthritis, again with braces, with all these medicines, etc. But the effectiveness which a grade 2 arthritis patient can probably get help, a grade 4 will not get that much help. So weight reduction, bracing, medicines, physiotherapy will allow you to manage for some time. But sooner than later, if it's an established grade 4 bone on bone disease, it will require knee replacement. If it's a younger patient, then it's a different matter. But anybody who's above 60, well, it should require knee replacement.
Thank you, sir. 1 minute, sir. Mr. Runita, you want to ask anything to doctor? If you have any question, please unmute and talk immediately.
Yeah, hi, this
Quickly,
is
you will ask.
Siddharth. Hope I'm audible. Am I
Yes,
audible?
yes, yes, we can hear you.
Hi, doctor. Doctor, I'm
Hi.
asking this question on behalf of my mother-in-law, Runita. So she
Right.
was diagnosed with chikungunya almost a month ago. And after that, she's having pain all throughout bones. So she has been on some painkillers. I mean, whenever you go to doctor, they prescribe a painkiller, and she took them around for 20 days. Now she's going for homeopathy. So our question is, are the painkillers safe? And second question is there any food that we should take which will help in subduing the pain? And third question is, till what time she'll experience this pain after chikungunya? So
So what she's having is what is called as reactive arthritis. So after chikungunya or after any sort of a viral affection, the joints can undergo reactive swelling. So although it's called reactive arthritis, it usually doesn't cause cartilage damage like we've been discussing. So it's a transient phenomenon where there's a lot of swelling and the cartilage is therefore hurting because of not receiving its nutrition. It's a self-limiting disease. It can vary from 6 weeks to even 12 weeks. It might take anywhere between 2 to 3 months also for it to subside by itself. Usually, of course, this is all after checking the patient and the reports. Usually, some blood reports will give a fair idea as to what stage of the disease she is in, and as if she is subsiding on from the reactive arthritis. And usually, some group of drugs which are safe otherwise, after evaluating the patient, some low dose steroids are usually given. Even the help of a rheumatologist can be taken for tackling reactive arthritis.
okay, any food you'd suggest which might help? I mean,
Not really. There is no dietary advantage of any particular diet for reactive arthritis.
okay. So are painkillers safe? I mean, if we are eating it for more than a month, or and I mean,
No,
right
so
now one I can see is naproxen was suggested to give.
yeah,
To
so
be given.
painkillers are more harmful. Low dose steroids systematically taken are more safer.
Okay.
Painkillers are more harmful because you said mother-in-law, so obviously she'll be on the higher side of age. Usually the creatinine will be on the borderline or higher in that age group. So it's not a good idea to take heavy painkillers. They can cause kidney damage. So
All
low
right.
dose steroids and paracetamol and opioid medicines, they are usually safer. But
So one last
NSAIDs
question. Sorry to interrupt you. One last question, doctor. She's around 60, and I'm assuming that this would subdue on its own in maximum 12 weeks, as you said, right? I mean,
that's correct. That's correct.
all right. Okay. Thank you. Thank you so much, doctor.
Thank you.
Thank you, sir. Sir, this is the last final question
Yeah.
in the chat box actually. She is having a varicose vein as well as arthritis both. 55 years old.
So if it's a varicose vein which is established, then what is needed, what is to be understood is that varicose veins patient, especially if it's a severe varicose veins, they can have what is called as edema. So the leg is swollen because the veins are not pushing out the liquid from the leg into the upper part of the body, into the heart. So the veins are weeping and there is swelling. that swelling causes more heaviness. So anything that increases load, either the person's body weight or excessive water in the leg, will cause more load, and therefore arthritis also can worsen. So treatment for varicose veins has to be taken. That's a completely non-orthopedic issue. So I, being an orthopedic surgeon, can only tell you that varicose veins has to be checked with a Doppler ultrasound. We need to find out as to what is the severity of the varicose veins. If it's very severe, again, there are surgical interventions for it, or usually calf exercises to strengthen the calf muscles, and stockings are given to make sure the swelling doesn't remain. And limb elevation has to be given whenever possible. Limb has to be elevated to reduce the swelling.
Thank you very much, Doctor, for your wonderful
Thank you.
answer. Sir, with your kind permission, we are going to share the contact details of your details.
Yeah.
Because if anybody wants to meet you, we are going to share the contact details. And
Sure.
Participant, if you want to consult with the doctor, we are going to share all the details in the group. Okay, please make a note, and if you want, you can take an appointment separately to meet the doctor. So thank you very much, Doctor, for your wonderful presentation. Thank you very much for joining, everyone. Thank you very much.
Thank you, everybody. Have a great weekend.
Thank you, Doctor. Thank you.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you.
Thank you.
Thank you.
Sir, Usharani Sawant here. Thank you.
Thank you. Thank you.